So what our group does is generally we're trying to improve the process for developing prediction models and make sure that when people are doing prediction, they're applying best practices and they're getting good models out. So there's three main areas really that we're focusing on. One is the methods research to make sure that we know what the best practices are. The other is actually applying what we've learned for the best practices to actually get clinically meaningful models or validate existing ones to see how well they're doing. And then the third thing is to use the OHDSI network to actually run network studies. So these are the three different things that we're doing inside the group. And if you're interested in any of these or all of these, we have our next meeting on the 8th of March at 9 a.m. Eastern time, which hopefully should be suitable for most people around the world. So our first OKR was to actually get more face-to-face activity going on within the group. So we're going to have some meetings in the European and the global and the Asia Pacific symposiums. So we're going to have lots of different face-to-face meetings. So wherever you're based, if you go to one of the OHDSI symposiums, you should be able to get to meet people face-to-face. So that's our first one. The next one is we want to also create some benchmark problems. So to actually evaluate best practices and see how well different methodologies and design choices actually impact the prediction. We want to have lots of prediction tasks to actually investigate. So we decided that we're going to set some time aside during our work group meetings to actually discuss different tasks, prediction tasks of interest. And the aim is to identify, say, 5 to 10, maybe more, if we are successful during the year, prediction tasks of interest, and we can then benchmark that and actually add these models to a website that Ross Williams has been leading to actually store prediction models and make it easy for people to see how well they're doing and also download the models, called Delphi. So we want to add these models to Delphi, and then we can actually start doing benchmarking pretty well on those tasks. The next thing is we want to investigate learning models for rare outcomes. So often when you have rare outcomes, you don't have many outcomes. It's hard to learn the models in a data set if the outcome count is low. So we're looking at different approaches for this. One thing is a stacker ensemble where you could learn models in different data and then kind of learn the stacker in the small data set, or you can do transfer learning, which is a similar process, learn a model in big data from a big database, and then you can fine tune it on a smaller data set. So we want to look at these methods and see how they compare, and also how they compare with just fitting the model in that small data set. So that's one investigation we're going to do this year. And then the next slide. We also want to look at external validation, understand it. So often when you apply a model to a new database, the performance is different to the performance internally. And there's lots of different reasons for this. And so we want to come up with tools to actually understand what's causing the increase or decrease in performance. Decrease is more common. And also we want to have tools that can perhaps estimate how well you're going to do externally just based on patient characteristics. So this will just give us a better feel for external validation. And then we also want to do some locally updating of models. So this is actually what we've realized is that a lot of the times we're fit a model and we do external validation, but we don't look at how well that does over time. And obviously the data changes, the healthcare system changes over time. So we want to look at getting tools into the package that will let us monitor this and investigate things over time and potentially update over time. So there's quite a lot of work we're going to be doing on locally updating models and seeing how they stand over time. And the next slide. So you can see we've got quite a lot of OKRs, so there's going to be plenty of areas of interest if you want to join us. And then the next thing is we want to also stratify the risks. So this is more trying to personalize the risk estimates for drugs. And one of the things of this was something called counterfactual prediction. So could we actually predict what your risk of certain events would have been if you had taken a different drug than the one you had? So this task is aimed towards that. So it's kind of the intersection of prediction and causal inference. And there's a lot of work that needs to be done for that. So we want to do some methods research into that.